Hello, everyone. Welcome to Clinical Veterinary Pharmacology. I am Clyde Celestial, and along with my other group mates, Ames La Chica, Divine Dormido, and Jairod Rapisa, we will discuss some topics under the Introduction to Chemotherapy. Specifically, here is the list of topics we will discuss: antifungal agents, antiviral agents, antiseptics and disinfectants, ectoparasiticides, and lastly, anthelmintics. Again, this is Clyde, and for the first topic, I will discuss about antifungal agents. So, what are antifungal agents? These are the drugs which kill or inhibit the growth of fungus in the body of the host and are used for superficial and deep or systemic mycosis. Some fungal infections are self-limiting, meaning they get cured without treatment. Clinically, fungal infections in animals can be classified into two groups: superficial fungal infections and systemic or deep mycosis. Additionally, antifungal agents can be classified into two groups based on their mode of application: systemic agents and topical agents. There are two types of fungal infection: superficial and systemic. Superficial fungal infections are infections in which a pathogen is restricted to the stratum corneum with little or no tissue reaction. They have an affinity for keratin and, therefore, are typically limited to either the epidermis or adnexal structures. They include dermatophytosis of the skin, hair, and nails caused by Trichophyton mycosporum or Epidermophyton species. Superficial infections also include candidiasis or moniliasis of the moist skin. Picture A and B are dermatophytoses that affect the skin, hair, and nails, while picture C and D are candidiasis or moniliasis. For the fungal infection, which is systemic or deep mycosis, they are caused by either an opportunistic organism that infects an at-risk host or may be associated with a more invasive organism that is endemic to a specific geographical area that's spread throughout the body. Systemic fungal infections include coccidioidomycosis, histoplasmosis, cryptococcus, candidiasis or blastomycosis, and many more. The pictures are some of the examples of infection to some animals. Antifungal agents have two different modes of application: systemic agents and topical agents. Systemic agents are used in the treatment of fungal infections of internal organs or GIT. Some of these may also be useful in treating dermatomycosis via blood and enter keratin-producing cells in the skin. On the other hand, topical agents are used for treating superficial fungal infections and is usually applied topically. Graciovulvin is used to treat dermatomycosis, but administered orally. After absorption, it enters in the keratin-producing cells in the skin via the circulation. A topical agent used for dermatophytosis should have both fungistatic and keratolytic properties. Otherwise, it should be combined with a keratolytic agent so that it can remove the keratin layer and facilitate the surface contact of the drug and the fungus. Here are some of the examples of systemic antifungal agents. First is the polyene antifungal agents. These include the amphotericin B, nystatin, and natamycin or primaricin. Here are some of the examples of systemic antifungal agents. First is the polyene antifungal agents. These include the amphotericin B, nystatin, and natamycin or primaricin. Amphotericin B is obtained from a strain of Streptomyces nodosus. It is active against a wide range of fungi. It remains the principal drug to be used against deep-seated systemic mycotic infections despite its toxicities. It is administered as IV infusion in the form of colloidal suspension. The drug is not absorbed orally, and therefore it is only given by this route for fungal infections of the GI tract, such as intestinal candidiasis. Its penetration into CSF or colony-stimulating factor is poor. The drug is used in the treatment of histoplasmosis, blastomycosis, coccidioidomycosis, cryptococcosis, and candidiasis. It is also used topically to treat mucocutaneous candidiasis. Monitoring of BUN or blood urea nitrogen or creatinine is necessary in animals undergoing amphotericin B to avoid renal toxicity. How does polyenes work? Well, pollines have high affinity for the ergosterol component present in the fungal cell membrane. They bind with ergosterol and form pores in the membrane and thereby interfere with the fungal cell membrane permeability and transport functions. There is efflux of intracellular potassium ions from fungal cells and influx of hydrogen ions, causing internal acidification of fungal cell and halt in enzymatic processes. The sugars, amino acids, and other water-soluble substances also leak out of the cell. These mechanisms result in fungicidal action. In addition, amphotericin B also acts as an immunostimulant in animals. Bacteria do not have sterols in their cell membrane and are insensitive to pollines. Cholesterol, present in mammalian cell membrane, resembles to ergosterol and pollines bind to it as well, though with lesser affinity. Therefore, selectivity of pollines is low and amphotericin B is one of the most toxic, specifically nephrotoxic and anaphylactic but systemically used antifungal antibiotic. However, it is the least toxic among pollines. Amphotericin B increases the antifungal action of fluoxytocin and their combination is the drug of choice in cryptococcal infection. The dose for amphotericin B is 0.1 mg per ml and 5% dextrose at 0.1 to 1 mg per kilogram through slow IV and should be given 3 times per week, and the total dose should be 4 to 11 mg per kilograms. Another drug is nystatin. It is an antifungal antibiotic obtained from Streptomyces norsei. Its antifungal action and other properties are similar to amphotericin B, but because of higher systemic toxicity, its usefulness is limited to treatment of candida infections of the skin, mucous membrane, and GI tract and applied either orally or topically. Its oral absorption is poor. It is the drug of choice for prevention and treatment of intestinal moniliasis. Its dose should be given orally at 22,000 IU kilogram per day in 3 divided doses. Lastly is the natamycin or primarisin. Natamycin is similar to nystatin and primarily used in the treatment of fungal keratitis. It is also a 5% ophthalmic solution which is applied topically, 1 drop instilled in the eye every 1 to 2 hours. Another group of systemic antifungal agents are the azoles. Imidazoles can be applied topically or systemically. Topical agents of imidazoles include clotrimazole, iconazole, and miconazole, while systemic agents include ketoconazole and thiabendazole. On the other hand, triazoles are also azoles which are systemic, and these include fluconazole and itraconazole. Imidazoles and triazoles have broad-spectrum fungistatic activity covering dermatophytes, candida, and some are also effective against systemic mycosis. For the mode of action, they inhibit fungal cytochrome P450 enzyme, ianosin 14-alpha demethylase, which converts ionosterol to ergosterol, which is the main sterol in the fungal cell membrane. The interference in ergosterol synthesis leads to structural and functional or enzymatic abnormalities in the fungal cell membrane. Triazoles are less toxic than imidazoles because of their lower affinity for mammalian cytochrome P450 and cause less interference with the mammalian sterol synthesis. Here are some of the drugs clinically used which are of veterinary importance. First is the ketoconazole. It is the first orally effective broad-spectrum antifungal drug useful in both dermatophytosis and deep or systemic mycosis. It is administered orally and is effective in the treatment of dermatophytosis as an alternative to graciofulvin and also very effective in histoplasmosis, blastomycosis, coccidioidomycosis, cryptococcus, and mucocutaneous candidiasis. It is less potent but much less toxic than amphotericin B. Orally, it is well absorbed and absorption is facilitated by gastric acidity since it is more soluble at lower pH. Azoles are widely distributed in the body. Their CSF penetration is poor and is largely bound to albumin, except fluconazole. They undergo extensive hepatic metabolism and excreted in urine and feces. Ketoconazole causes microsomal enzyme inhibition and thus inhibits the metabolism of many drugs. Also inhibits steroidogenesis. It can be used along with amphotericin B or 5-fluoxytocin to potentiate the antifungal activity. It causes GI disturbances, hormonal and reproductive disorder in dogs, and it should not be given to pregnant animals. In dogs, its dose is at 5 to 20 milligrams per kilograms twice daily. Another drugs are the fluconazole and itraconazole. Their pharmacological properties are similar to ketoconazole, but they have wider range of antifungal activity and are less toxic, hence preferred for the treatment of systemic mycosis. Fluconazole has high tissue including CSF penetrability and low nephrotoxicity. It is combined with amphotericin B in treating cryptococcal meningitis. The dose of fluconazole and itraconazole in dogs is at 5 to 10 milligrams per kilograms twice daily. Last drug is the flucytosine. It is a synthetic narrow-spectrum fungistatic drug active against few strains of Cryptococcus, Candida, Aspergillus, and Chromoblastomyces species. The other fungi causing systemic mycosis or dermatomycosis and bacteria are insensitive to flucytosine. It is a pyrimidine antimetabolite and inactive as such. It is converted to the antimetabolite 5-fluorouracil by cytosine deaminase in the fungal but not in mammalian cells. 5-FU inhibits thymidylate synthase and thus DNA synthesis. Mammalian cells are not affected because of very limited ability to convert flucytosine to 5-FU. It is rapidly absorbed orally and widely distributed in the body and has excellent penetration to tissues and fluids including CSF. Its main indications are cryptococcal meningitis in combination with amphotericin B, candidiasis, aspergillosis, and chromomycosis. It is less toxic than amphotericin B. The dose should be given orally at 25 to 50 milligrams per kilograms thrice a day in dogs and at 30 to 40 milligrams per kilograms thrice a day in cats. Some of the antifungal agents are applied topically, and here are some of the examples which are of veterinary importance. First is the griseofulvin. Griseofulvin is the drug of choice in treatment and prevention of ringworm in calves. It is obtained from a fungus called Penicillium griseofulvum. It is a narrow-spectrum fungistatic agent active against most dermatophytes and administered orally for treatment of ringworm in dogs, cats, calves, horses, and other domestic animals along with a topical antifungal agent. It is ineffective against candida and other fungi causing systemic mycosis and bacteria. High dietary fat intake promotes absorption of griseofulvin from GIT. For the mode of action, dermatophytes selectively concentrate griseofulvin by an active process. It first interacts with polymerized microtubules, thus causing disruption of mitotic spindle and susceptible dermatophytes, and this results in interference with mitosis. After oral administration, the absorbed drug gets deposited in the keratin precursor cells of stratum corneum, exerts fungistatic action, and prevents fungal invasion of deeper layers. The superficial cells containing the fungus and keratin are shed off and replaced by healthy cells from the deeper layer of the skin. The treatment should be continued at least 1 week after the disappearance of clinical signs. It is given orally, and the dose in dogs and cats should be at 10 to 30 milligrams per kilograms a day in 1 or 2 divided doses for 4 to 8 weeks. However, in horses and cattle, the dose should be at 5 to 10 milligrams per kilograms a day in 1 or 2 divided doses for 4 to 8 weeks. A large number of antifungal agents are also applied topically on the skin, in the ear or eye, or in the mucous membrane to control superficial or local fungal infections. The drugs are first antisylanic acid. It is a 10% powder or alcoholic solution. It has potent fungistatic activity and use in superficial fungal infections and to treat fungal mastitis. Other fatty acids like caprylic acid and propionic acid also has fungistatic action. Next are the imidazoles. These include clotrimazole, a 1% cream or lotion, and meconazole, a 2% cream or lotion. They are used topically against dermatophytes and candidiasis. Iconazole, a 1% cream, is the most active topical imidazole used especially in candidiasis. Thiabendazole is given topically or orally in calves to treat ringworm infection with a dose of 22 milligrams per kilograms twice a day orally. Next drug is the tolnaftate, a 1% lotion. It is active against dermatophytes but not against candida and bacteria. It is used topically with oral grasulfulvin. Another drug is the benzoic acid. Both salicylic acid 3% and benzoic acid 6% are used to prepare wheat-filled ointment, an antifungal ointment. Benzoic acid has both fungistatic as well as keratolytic activity and is used in dermatomycosis. Next is cyclopyroxalamine. It is a broad-spectrum antifungal drug active against all dermatophytes and candida. It is used to treat dermatomycosis and candida infections. Another topical antifungal agent is haloperidin. It is a synthetic antifungal agent used to treat dermatomycosis in dogs. Another drug is candidicin. It is fungistatic and fungicidal antibiotic active against candida and mainly used in moniliasis. It is also used in dermatomycosis like ringworm. Amorolfine is also topically used to treat dermatophytosis. Iodochlorhydroxyquine possess both antibacterial and antifungal activity and used topically to treat mixed infections, whereas coprimycin has antifungal as well as a broad-spectrum antibacterial activity since activemycin is released on application. Coprimycin is used topically. Terbinafine is occasionally used in dogs and cats, topically as 1% cream or orally at 5 milligrams per kilograms a day for 7 weeks. It is against dermatophytes and candida. It decreases ergosterol synthesis in fungus. Another drug is the salicylic acid. It has fungistatic action and is a component of many topical antifungal preparations because of its good keratolytic activity. It is mainly used to treat chronic superficial dermatomycosis. There are also other agents applied topically. Phenols, iodine, and mercurials have antibacterial as well as antifungal activity, but they may cause normal tissue damage. Carbofucin solution is also applied topically twice daily for 7 days. Gentian violet is used in candidiasis. Topical antifungal preparations generally contain antipyretic, a corticosteroid, and an antihistamine in addition to the antifungal agent.
Hi, I am Jaira May Cedar Pisa, and today we are going to talk about the antiviral drugs. The following are the antiviral chemotherapy principles. First, drugs that affect the viral processes must penetrate the host cells, and in doing so, they are likely to adversely affect the normal pathways of host cells. Second, most of the antiviral drugs are nucleic acid analogs and interfere with viral nucleic acid synthesis, such as DNA or RNA, or regulation. Third, the main objective of antiviral chemotherapy is to eradicate the virus with little or no damage to the host and to prevent further viral infection. The antiviral drugs are classified based on mechanism of action and based on type of virus affected. The following are the classification of antiviral drugs based on mechanism of action. First, preventing viral attachment to and penetration of host cells. Second, neuraminidase inhibitors. Third, transcription analogs. Fourth, late translation inhibitors. And then the DNA polymerase and DNA synthesis inhibitors. Additionally, the mode of actions of reverse transcriptase inhibitors, protease inhibitors, the interference in protein synthesis, interference with viral maturation, and host immunomodulators. On the other hand, the classification of antiviral drugs based on the type of virus affected, these are the anti-herpes virus, antiretrovirus, anti-influenza virus, antipox virus, antiviral antibiotics, and the non-selective drugs. And now, let's discuss further the different antiviral drugs. The idoxuridine is the first antiviral drug used clinically in man. It is effective against DNA viruses only and is indicated in the treatment of corneal and skin infections with herpes virus in man and animals. Also, it has high systemic toxicity. Acyclovir is an equally effective and better tolerated alternative. It is used as zero point 0.1 ophthalmic solution, 1 drop, topically every 1 to 2 hours. The drug trifluridine. It is related to idoxuridine and an analog of dioxythymidine. It is the current drug of choice for herpes simplex keratitis in man. It is used as 1% ophthalmic solution, 1 drop topically every 2 hours for 2 days and then 4 to 8 times daily. Next is the cytarabine. Cytarabine is an analog of cytosine deoxyribose. In cell culture, it has activity against the herpes virus, pox virus, Vaccinia, and rabies virus. It has topical activity against herpes virus and Vaccinia keratitis, but systemic antiviral activity has not been established. Vidarabine. Vidarabine is an adenine analog which is phosphorylated by cellular enzymes to triphosphate that inhibits many viral and human DNA polymerases and thus the DNA synthesis. Vidarabine is more selective than idoxuridine but less so than acyclovir. It is used topically for ocular herpes infection and systemically for herpes simplex encephalitis for mucocutaneous herpes and pox virus infections, but now has been replaced by acyclovir. Additionally, it may produce bone marrow and CNS toxicity at higher doses. It is applied as 3% ophthalmic ointment, zero point 0.5 centimeter ointment applied topically every 5 to 6 hours, 3 to 6 times daily. In injection form, 200 mg per milliliter at 10 to 30 mg per kilogram intravenous once daily. Acyclovir. The acyclovir triphosphate competitively inhibits herpes virus DNA polymerase and also gets incorporated in viral DNA and stops lengthening of DNA strand. Acyclovir is a relatively safe antiviral drug having wide margin of safety. It is widely used in H. simplex infection and in chickenpox through intravenous in man and in feline herpes virus infection, 200 milligrams orally 4 times daily. Its preparations and doses are 5% cutaneous ointment 6 times daily for 10 days. For tablet, 200 milligram oral at 15 milligram per kilogram per day for 7 to 10 days. For injection, 500 mg per vial powder at 5 to 10 milligrams per kilogram per day, intravenous for 7 to 10 days. Ganciclovir. It is a synthetic guanine analog, also an antiviral purine nucleoside having virus specificity and mechanism of action similar to acyclovir. It has high systemic toxicity and use is restricted in the prevention and treatment of cytomegalovirus or CMV, which is known as the severe retinitis infection in immunocompromised patients. So dose is 10 milligram per kilogram per day intravenously. Foscarnet. Foscarnet is a phosphate acts by inhibiting viral DNA polymerase and reverse transcriptase. It has high nephrotoxicity. Its clinical use is similar to ganciclovir. Next, the drug zidovudine. This is a thymidine analog, mainly effective against retroviruses and used in the treatment of human immunodeficiency virus or HIV, a double-stranded DNA virus infection. After phosphorylation in the body, zidovudine triphosphate selectively inhibits viral reverse transcriptase in preference to host cellular DNA polymerase. So this is the current choice of drug in HIV treatment. This is the dose for this drug, 500 milligram per day, orally in 2 to 4 divided doses with plenty of water. The drugs sakinavir, indinavir, ritonavir, and nelfinavir. In HIV, The vital mRNA transcribed from the provirus 7 is translated into two inert polyproteins. A virus-specific protease converts these polyproteins into various structural and functional proteins by cleavage at specific positions. HIV-specific protease inhibitors bind to the site where cleavage occurs and thereby inhibit the synthesis of viral proteins. Since the protease does not occur in the host, these drugs are highly effective in therapy of AIDS in combination with reverse transcriptase inhibitors. The drugs didanosine and stavudine. These are pharmacologically similar to zidovudine and they are indicated in HIV patients not tolerating AZT or for AZT-resistant HIV. Next drug is called the methizazone. It is an istatin 3 semicarbazone effective against pox and adenoviruses. It is used in the treatment and prevention of smallpox in man. It must be administered orally. It may cause anorexia and vomotion. It acts by preventing the replication of virus by inhibiting fate translation of mRNA, thereby blocking the synthesis of structural proteins. Amantadine. Amantadine is a cyclic amine highly effective against influenza virus. It is not a viricide but blocks the penetration of the virus into the host cell and inhibits the uncoating of the virus particle. It also interferes with the early stage of viral mRNA transcription. It is indicated in prevention of treatment of influenza A, virus infection in man, and influenza infection in chicken, turkeys, and horses. Moreover, it acts by preventing the replication of virus by inhibiting fate translation of mRNA, thereby blocking the synthesis of structural proteins. It is well absorbed orally. It may cause CNS stimulation at high doses. For its dose, in adult men, 100 mg capsule orally twice daily. In children, 5 mg per kilogram per day orally. For chickens, 25 mg per kilogram in drinking water. The next drug is called rimantadine. Rimantadine is a more potent and long-acting derivative. For its dose, in man, 200 mg orally once daily. Drugs oseltamivir and zanamivir. In influenza virus, the action of neuraminidase is involved in the budding of new virus from infected cells. These drugs act by inhibiting the action of this enzyme. In treatment of bird flu, these drugs are commonly used. The bird flu virus may show resistance to amantadine or rimantadine, hence oseltamivir or zanamivir are preferred. Rifamycins, or also known as rifampin, it hin- Rifamycins, or also known as rifampin, it inhibits viral mRNA polymerase and interfere with the assembly of viral proteins and maturation of virus. Next is the drug called interferons. Interferons are a group of proteins liberated by mammalian cells infected by viruses. They make the neighboring cells less susceptible to viral infection and contribute to the host resistance. They have nonspecific antiviral activity and inhibit many RNA and DNA viruses. However, they are more specifically effective against its specific inducer virus. They are host-specific and interferon from one species cannot be used to protect another. Three types of interferons have been detected. These are the alpha, beta, and gamma. They are produced by recombinant DNA technology. Interferons bind with specific cell surface receptors and affect the replication of virus at various steps. The most important effect is inhibition of viral mRNA and protein synthesis. Besides this, they also affect the virus penetration, assembly of viral particles, and their release. Meanwhile, the interferon inducers are drugs that protect animals against viral infection. Next, the drug called polyribioinosinic acid or called polyribocytidilic acid. This drug is used in viral hepatitis in dogs and rabies in mice. BRL 5907, a metabolite of a fungus, contains double-stranded RNA. It protects cattle against FMD virus if given before challenge. Gamma globulins. Gamma globulins are concentrated antibodies extracted from normal blood may also be useful in preventing viral infections or prophylaxis in man and animals. Levamisole. Levamisole used primarily as anthelmintic but also has immunostimulant action. Herpes infection in man responds to levamisole also. And lastly, the antiviral drugs used in AIDS or HIV protease inhibitors. These are the sakinavir, ritonavir, indinavir, nalfinavir, and amprenavir. That ends the report of my presentation in antiviral drugs. Let's proceed to another topic. Antiseptics and disinfectants. The chemical used for the purpose of non-selective killing or inhibiting the growth of microbes such as bacteria, viruses, fungi, and protozoa on contact are called as germicides. Antiseptics are considered as germicides applied on living or animate surfaces such as skin and mucous membrane to suppress or prevent microbial infections. Disinfectants, on the other hand, are germicides usually applied to surfaces of inanimate objects. Moreover, topically antiseptics are used in aseptic surgery for antisepsis of the surgical site, surgeon hands to treat local infections, in soap, and in teeth dips. Disinfectants are used to disinfect surgical instruments and apparatus, hospital, home, or farm premises, and in public health sanitation. The following presented are the characters of an ideal antiseptic. First, it should have wide antimicrobial activity against all pathogens, such as bacteria, viruses, fungi, and protozoa, and should be preferably cidal. Second, it should be active even in the presence of blood, pus, and tissue breakdown products. Third, antiseptic should exert rapid and sustained germicidal action. It should not delay wound healing and be compatible with soap and detergents. Antiseptic should be chemically stable and cheap and readily available. These are the lists of mechanism of action of germicides. Oxidation of microbial protoplasm, oxidizing agents, halogens, and halogen derivatives. Denaturation of microbial proteins or enzymes such as phenol derivatives, metals, alcohols, and interfering with the permeability of microbial cell membrane such as detergents. Additionally, the potency of a germicide is generally expressed in terms of its phenol coefficient or Rideal-Walker coefficient. It is the ratio of the minimum concentration of the test chemical required to kill a 24-hour culture of Bacillus typhosa in 7.5 minutes at 37.5 degrees Celsius to that of phenol under similar situations. Classification based on chemical nature. Under this are the phenol derivatives. Phenol derivatives are used as antiseptics or disinfectants. These are protoplasmic poisons and denature proteins. There are two phenol derivatives. These are the phenol or the carbolic acid and the cresol or the cresilic acid. The phenol or carbolic acid is relatively a weak bacteriostatic at 0.1 to 1% and bactericidal or fungicidal at 1 to 2%, mainly used for disinfection of equipments or organic matter at 3 to 4% and not used as antiseptic as it is irritant, corrosive, and cause systemic toxicity. Meanwhile, the cresol or the cresilic acid, it is a bactericidal. Cresol is a better disinfectant and less toxic than phenol. Used as 2% solution as a disinfectant for inanimate objects. Both phenol and cresol are toxic to dogs and cats and should not be used to disinfect the kennels and cat cages. That ends my presentation. This topic will be further discussed by the next reporter. Again, this is Jeremy Cedar Pisa of 3DVMB.
Another classification of antiseptics based on chemical nature is the resorcinol. Its antimicrobial activity is similar to phenol. It is also keratolytic and antipruritic and used in seborrheic dermatitis and ringworm and eczema as a 6% lotion. Next is the chloroxylenol, a 4.8 solution Dettol. It is a broad-spectrum bactericide used for surgical antisepsis. It is diluted with water for skin sterilization, for cleaning of wounds, and irrigation of uterus and vagina, and for mouthwash. Next is hexachlorophene. It is a strong bacteriostatic against mainly gram-positive organisms and widely used in solid or liquid soaps for preoperative skin antisepsis. Last is the wood tar derivatives. Pine tar antimicrobial action is due to the presence of phenol derivatives. Guaiacol is the main constituent of creosote, also used as expectorant and antitussive. 3% hydrogen peroxide is used as an antiseptic on surface wounds and disinfectant in water treatment and for sterilization of dental and surgical instruments. Benzoyl peroxide, on the other hand, has antiseptic, keratolytic, and antiseborrheic activity, thus, it is useful in treating pyoderma in dogs. Another oxidizing agent is potassium permanganate. It has broad spectrum antimicrobial action, including bacteria, fungus, and virus. A 1 to 5,000 solution is used as an antiseptic for irrigation of mucous membrane, cavities, and wounds. It is also used to disinfect water. However, it stains the tissues and promotes rusting, so it is not good for surgical instruments. Peracetic acid, on the other hand, is a recently introduced antiseptic and sterilizing agent active against bacteria, fungi, and viruses, and it is used in the food industry, meat and poultry processing plants, and dairies. Halogens are used as antiseptic and disinfectant. Halogens are used as topical antimicrobial agents. They bind with the protoplasm and oxidize proteins and interfere with vital metabolic functions of microbes. Iodine is a potent, broad-spectrum, and rapidly acting microbicidal agent. At 50 ppm concentration, it kills bacteria within 1 minute and spores in 10 minutes. Tincture iodine or 2% iodine is used as antiseptic on skin before surgical incision or hypodermic injections and wounds. In large animals, it is used as 7% solution. Lugol's iodine or 5% iodine is used for irrigation of uterus in pyometra. Iodophores, such as povidone iodine on the other hand, are called iodine bearers. Povidone iodine is iodine with polyvinyl pyrrolidine used as a non-toxic, non-irritating, and non-staining general antiseptic available as solution, spray, or ointment containing 0.5 to 1% iodine, whereas chlorine is a potent broad-spectrum antimicrobial agent and kills most pathogens, bacteria, viruses, fungi, or protozoa. It is widely used to disinfect water supplies and inanimate objects and dairies. However, it is irritating to skin and mucous membrane. Next are the chlorophores. These include sodium hypochlorite, a 2 to 5% solution, and is used to disinfect inanimate objects, and a 0.5% solution is used to irrigate dirty or suppurative wounds. It also includes calcium hypochlorite that contains 2 to 5% chlorine. It is used as disinfectant in serious infectious diseases such as anthrax, tetanus, and tuberculosis. On the same list is chloramine T. It is bactericidal and releases chlorine. It is non-irritating, excellent for washing suppurative wounds, dairy equipment, bovine udder, and milking machines. Chlorinated lime, on the other hand, is a bleaching powder. It is a mixture of calcium hypochlorite and calcium chloride. It is kept airtight as it loses chlorine on exposure to air. It is effectively used to disinfect livestock quarters and water if in an emergency.
Biguanides, sometimes an alternative sanitizer in place of chlorine. These include chlorhexidine, the most important of this group. A powerful, non-irritating antiseptic, acts by disrupting bacterial cell membrane. It is more active against gram-positive organisms, and it is one of the most common surgical and dental antiseptics. Gluconate as 4% emulsion is used as skin cleanser by hospital personnel. In the form of 1% aqueous solution or 0.5 solution in 70% isopropanolol, it is used as general antiseptic. A 1% chlorhexidine acetate ointment is typically used as antiseptic for treatment of wounds in dogs, cats, and horses. Surfactants. These chemicals reduce the surface tension of an aqueous solution, and in veterinary medicine, they are mainly used as antiseptics and disinfectants. Surfactants may be non-ionic, anionic, and cationic. The non-ionic are not bactericidal. The anionic agents are active in mild acid solutions, and the cationic detergents are active in alkaline medium. Acids. Hydrogen ion is bacteriostatic or cidal. Inorganic acid include boric acid, a weak antiseptic non-irritating to even delicate tissues, is used as topical antiseptic in the eye infections and as mouthwash. Organic acids include acetic acid. It is used in surgical dressings for irrigation of urinary tract, to treat otitis externa, and to treat burn infections. Alkalis. Hydroxyl ions also have antimicrobial activity. A 2% soda lye in boiling water is widely used to kill common bacterial pathogens such as those causing fall cholera and pulmonary disease. Sulfurated lime topical solution is used as scabicide in veterinary medicine. Alcohols. Primary aliphatic alcohols are widely used antiseptics and disinfectants. They precipitate bacterial cytoplasmic proteins, and the effect is related to their lipid solubility. Ethyl alcohol, 70% ethanol, has strong antibacterial action, kills 90% bacteria within 2 minutes, but not against the spores. It is commonly used as skin antiseptic before surgical incision. As it is an irritant, it should not be applied to mucous membrane or on delicate tissues. It is a poor disinfectant for instruments and promotes rusting. Isopropyl alcohol, isopropanol 50%, has similar action to ethanol. Reducing agents. Formaldehyde and glutaraldehyde are used as disinfectants. They have potent germicidal properties against all microbes, including spores, and retain the activity even in the presence of organic matter. They are non-corrosive to metals, paints, and fabrics. Their solutions are highly irritating and caustic to the tissues. Formalin contains 37% formaldehyde gas in aqueous solution with methanol, is used as fumigant disinfectant or disinfect spray for buildings. The combined solution of formaldehyde 10% and phenol 5% is used as disinfectant footbath. Glutaraldehyde, 1 to 2% alkaline solution in 70% isopropanol, used to sterilize surgical and endoscopic instruments and plastic and rubber apparatus. Sulfur dioxide, a gaseous fumigant produced by burning sulfur in closed areas. Its efficacy is maximum when the surfaces are moist as the gas dissolves in water to form sulfurous acid, which is bactericidal, but is corrosive to metals and fabrics. Heavy metals include mercury compounds, silver salts, and copper sulfate. Mercury compounds, the inorganic mercuric bichloride, is an early mercurial antiseptic replaced by less irritant and less toxic organic mercurials like merbromine, thimerosal, nitromerisol, and phenylmercuric nitrate. The mercurials are weak antiseptics and act as bacteriostatic by inactivating SH enzymes of microbes. They are ineffective against spores. Their antiseptic or disinfectant use is greatly decreased because of environmental contamination. Silver salts. These are microbicidal through astringent and caustic actions. The silver ion combines with SH, aminophosphates, and carboxylic groups, resulting in denaturation and precipitation of bacterial proteins. Silver nitrate is a strong antiseptic and used for ophthalmic infection. Silver sulfadiazine is highly active against Pseudomonas and used on burns. Colloidal silver preparations slowly release non-irritating silver ions used as mild antiseptic in ophthalmic preparations. Zinc salts, sulfate or oxide, are astringents, corrosive, and used as mild antiseptics in the form of powder, ointment, or lotion. Copper sulfate. It has astringent, fungicidal, and germicidal activities. Dyes include azo dyes, acridine dyes, and gentian violet. Azo dyes are effective against gram-negative organisms, particularly in acidic medium. Scarlet red is commonly used as 5% ointment on sores, chronic ulcers, and wounds. Phenazopyridine is used as urinary tract antiseptic and in combination with sulfonamides in urinary tract infections. Acridine dyes. These are more active against gram-positive bacteria, especially in alkaline medium. They are non-irritant and do not retard healing. The bandages and gauze are impregnated with acriflavine jelly and extensively used for treatment of chronic ulcers and for burn dressing. Gentian violet. Gentian violet is active against staphylococci, other gram-positive bacteria, and fungi, but not against gram-negative bacteria and mycobacteria. It is used as antiseptic, 1% solution in 10% alcohol, in bed sores, chronic wounds, and ulcers on mucous membranes, moist eczema, and ringworm. Nitrofurazone. A nitrofuran derivative is bactericidal to both gram-positive and gram-negative aerobic and anaerobic bacteria, acts by inhibiting enzymes of carbohydrate metabolism in bacteria. Its activity is reduced in the presence of serum. It is highly efficacious topically as 0.2% cream in burns and skin infections. Good day, this is Divine Grace A. Dormido, and I will be discussing ectoparasiticides. These are agents used to control or eradicate insect pests. The arthropod parasites include lice, mites, flies, and ticks which parasiticize the body surface of the animals. These insects also serve as vectors of diseases for both man and animals. Classification of insecticides based on mode of access into the insect's body. Contact poison exerts insecticidal action through contact. Insecticide is applied over the body surface of the animals, which gets selectively absorbed into the insect's body through its chitinous cuticle following surface contact. Stomach poison. Absorption of eaten insecticide as tissues or fat into insect's body through the membrane in the midgut of the insect. Systemic poison. The insecticides are either absorbed through animal skin or stomach and then distributed throughout the body. Fumigants is released in the air as gas or suspension and it enters into the insect's body through respiratory system. Classification of insecticides based on chemical nature. Organochlorines include chlorinated ethanes, cyclodienes, and hexachlorocyclohexanes. Organic phosphates. Esters of phosphoric group or its thioanalog include dichlorvos, haloxone, diazinon, phention, malathion, and trichlorphon. Carbamates include carbaryl and propoxur. Pyrethroids include alitrine, permethrin, and cypermethrin. Microcyclic lactones include avermectins and melbimycins. Chloronicotienols include imidacloprid and spinosins. So, imidacloprid is a chlorinated derivative of nicotine. Formamidins includes amitraz. Insect growth modifiers include benzophenolureas, triazine derivatives, pyrimidine derivative, and juvenile hormone analog. Mode of insecticidal action. Organochlorines, most of these are withdrawn from usage because of their non-biodegradable nature, environmental persistence, and associated health hazards in man, animals, and birds, accumulative nature, or biomagnification. However, lindane under hexachlorocyclohexanes and methoxychlor under chlorinated ethanes are used typically because of their relative safety and efficacy. The organochlorines are nervous poisons, a neurotoxicity due to high lipid solubility, act by prolonging the depolarization phase, the delayed closure of sodium channels, resulting in repetitive discharge and overexcitability of the motor nerves, and or by antagonizing the actions of inhibitory transmitter GABA in the insects. Hyperexcitability is followed by paralysis of the insect known as the knockdown effect. Organophosphates. These compounds are acutely more toxic and have less environmental persistence as compared to organochlorines. It acts by irreversibly inhibiting the action of acetylcholinesterase at cholinergic synapses and at the muscle end plates. This results in accumulation of acetylcholine at the postsynaptic membrane, leading to neuromuscular paralysis. Carbamates. These also act as anticholinesterase like organic phosphates but cause reversible inhibition of the enzyme. Pyrethroids. The synthetic pyrethroids are very much popular as ectoparasiticides because of their selective toxicity to insects and are generally safe in mammals and birds. Further, these are highly biodegradable, but these are highly toxic to fishes. Pyrethroid compounds interfere with sodium channel present in the axonal membrane of the parasite neuron, causing delayed repolarization and paralysis of the insect like organochlorines. Macrocyclic lactones. Avermectins are the fermented products of Streptomyces avermitilis, while melbimycins are the products of Streptomyces cyanogriseus. These compounds are effective against a wide range of nematodes and arthropods and as such referred as insecticides. The macrocyclic lactones act by increasing the release of inhibitory neurotransmitter GABA from the nerve endings and its binding to its receptors. This leads to increased chloride ion conductance into the nerve cells and hyperpolarization. Recently, it has been proposed that ivermectin increases the chloride conductance by acting on a glutamate-gated chloride channel receptor. Amitraz is used against mites, lice, and ticks in domesticated animals as spray or dip. It is relatively safe in mammals but contraindicated in horses. In insects, monoamino oxidase is involved in amine neurotransmitters metabolism, and octopamine causes tonic contractions of muscles. Amitraz acts by inhibiting monoamino oxidase and as agonist of octopamine receptors. The use of amitraz in horses appears contraindicated because of the common occurrence of severe colic. Chloronicotinals and spinosins act by interfering with cholinergic transmission in insects by binding to nicotinic acetylcholine receptors. All exert knockdown effect or rapid kill on the insect parasites. Insect growth modifiers. These chemicals do not kill the insect parasite directly but interfere with the growth and development of immature stages, the insect development inhibitors. The benzylphenylurias inhibit chitin formation in cuticle of insects. Triazine and pyrimidine derivatives interfere with deposition of chitin into the cuticle but not its synthesis. Mitoprene, being analog to insects' juvenile hormones, antagonizes their action in metamorphosis of larval stage to adult insect. Pyperonil butoxide is synergistic with knockdown insecticides. It inhibits the microsomal enzyme system of arthropods and prevents inactivation of the insecticides. Application of ectoparasiticides. Most of the insecticides are applied topically, but some are also applied systemically. Depending upon the insecticide, target parasite, and the host. Pour-ons contain high concentrations and they are either absorbed through the skin and act systemically or act by surface contact. Dips are used for the control of mites, tick, lice, and flies in sheep, cattle, goat, and horse. In organochlorines, methoxychlor is used in cattle using the method spray, effective against ticks, flies, and lice. In organic phosphates, dichlorvus is used in dog using a method of color, effective against ticks and fleas. Carbamates. Carbaryl is used in dog, effective against ticks and fleas. Pyrethroids. Cypermethrin is used in sheep, effective against lice, ged, and scab. For amitraz, it is used in dog, sheep, and cattle using the method dust and spray, effective against ticks, lice, and mites. Ivermectin usually used in dogs, injected subcutaneously, effective against mange mites. Rotenone is for dog and cat, effective against fleas, ticks, and lice. Botanical insecticides. Natural insecticides or repellents include nicotine, rotenone, pyrethrum, azadirachtin, garlic oil, and curcumin. The other natural insect repellents are cinerines, yasmulines, citronella, and indolone. Insect attractors help in attracting the insects to a particular site where they can be killed by application of insecticides.